Hello, everyone, and welcome to another special episode of Arthritis Consumer Experts #CRArthritis series. I'm Kelly Lenvoy from ACE, and today I'm very happy to be joined by not one guest, but two guests. Daphne To, PhD candidate at the Institute of Health Policy, Management and Evaluation, University of Toronto, and Women's College Hospital Institute for Health System Solutions and Virtual Care. And also welcome Gabrielle Gabby Sraka, who is a PHSC student at McMaster University. Daphne and Gabby, welcome.
Thanks for having us. Nice to meet everyone.
Thank you.
Now, we have both of you appearing on the same episode because your posters are actually next to each other. One of them, Daphne's, is titled "What Characteristics Are Needed for Optimal Team-Based Rheumatology Care? A Qualitative Study Exploring the Experiences and Perceptions of Rheumatology Health Professionals." And Gabby's poster presentation, it's like a one-stop shop, a qualitative study exploring patient experiences in receiving interdisciplinary team-based care for rheumatic and musculoskeletal diseases. So at the very start, we're going to go over some definitions. Certainly, our audience and listeners have been hearing a lot about community-based care, team-based care as it relates to the delivery of healthcare across Canada. A lot of the provinces and territories are transforming the way they deliver care, and certainly for rural and remote patient populations, community and team-based care is something that is being discussed um, constantly and is a real focus. I guess I would like to start off by getting both of your definitions in terms of from your research perspective and your expertise. What is interdisciplinary care and what are team-based care models? Daphne, I'll start with you.
So, interdisciplinary care, how we kind of define it is when we have multiple health professionals kind of working together and using their complementary skill sets to, like, for patient management. So, I guess in the rheumatology setting, for example, like in some of the work that we've been doing, we have rheumatologists and other allied health professionals, for example, like physiotherapists, occupational therapists, pharmacists, nurses, all kind of working together, sharing roles. Patients are generally seeing multiple of these health professionals for a variety of different things. And what's really nice about the model, especially at the place that we've been conducting our research, is that everybody is kind of in the same place. So as Gabby's poster is titled, like the one-stop shop um, type of approach, where everybody can receive these services all under at the same clinic.
Gabby, she's kind of stealing your thunder there, but you have described it as one-stop shopping for patients. What aspects of this model did your research indicate or find patients found most beneficial?
Um, for me, there was definitely a lot of focus on the fact that they have better access to care providers. So they felt that they could communicate with the care providers between their visits because of that open line of communication, either a physiotherapist, a pharmacist, or someone else could speak to them. There's also a good sense of comprehensivity to the care. They felt that they could have all these providers in one place and have really thorough appointments over an hour, sometimes, and allowed them to have better opportunities to communicate their care, engage in their care, is there is a better sense of confidence there as well. So definitely that comprehensivity and that better access for sure.
Daphne, I'll go back to you. What did your research find were perhaps the biggest challenges in implementing disciplinary rheumatology teams? And did you come up with any solutions about how these barriers could be addressed to improve patient access to care?
So great question. I'll just start by saying that the data from our projects come from a case study that our team conducted, and that was with one example of a team-based rheumatology clinic. That's a clinic in Newmarket, Ontario. So kind of all of our data comes from people who've either worked at this clinic or received care from this clinic, and I think that kind of informs their perspectives that we're going to be talking about. So, from the health professional perspective, they've certainly talked about a variety of things that they thought were really necessary and really key for high quality team-based care. So, they could be seen as challenges if these items are not in place, um, or they could also be seen as opportunities for, where we might be able to make some improvements. So people were saying, I think from the program or the clinic perspective, really important to have things like shared workspaces, so that there could be spontaneous collaboration, shared electronic medical records to just keep everybody on the same page, and competitive compensation. If you take away those things, then it's really hard to sustain that clinic for interdisciplinary care. From some of like the health professional perspectives, they also need things like time and training in rheumatology to develop their rheumatology related skills. And they also need that kind of team mindset, right? So if you are not adaptable, if you're not open to feedback, if you're not willing to collaborate, if you don't trust the people that you're working with, then that might be a challenge in working in this type of environment. But I think it's really important to emphasize that, despite some of these challenges that people might be experiencing while working within these teams, or despite any challenges that they might experience, um, they really saw the value that um, the interdisciplinary team brought to patient care. And they really truly believed that it was leading to better patient outcomes and higher patient satisfaction. So that all of the stuff, all of the struggles and the challenges that they were going through or had to go through to get to where they were, made it all worth it. So I think that's really important to highlight that even though there might be challenges in getting to a really truly interdisciplinary model of care, that for a lot of the health professionals that we talk to here, having those really positive patient outcomes and seeing the smiles on those patients' faces really made it all worth it for them.
That's great. Thank you. Gabby, I'll ask you the same question. And I guess from your research, from the patient perspective, what kind of challenges or concerns were identified by patients, and what improvements do you think we could make to make the model even better and more responsive to patient needs?
Yeah. I was lucky to have very few negative comments towards a lot of the patients. A lot of them had really high expectations and really enjoyed the model. There were some comments few and far between in terms of the fact that having these long visits and having all these practitioners could be overwhelming to some patients. And so I think it's important to consider that not all people might benefit from the model, as well as understanding that sometimes simplicity is important, kind of recognizing that. There were also some diseases that were better suited for the care model in terms of inflammatory arthritis was usually better suited than some other diseases, as well as diseases that might be a little bit more rare, that might need, as Daphne was mentioning, a little bit more education, a little bit more understanding. And so those were some of the concerns that we had, but they were definitely very few and far between and were not necessarily representative of the entire population.
Did either of you also look at we spend quite a bit of time here at ACE working on areas of health equities and health inequities. So I'm just wondering if you looked at what the benefits or challenges could be for patient populations who might have, cultural, ethnic, socio-demographic um, issues or concerns, and is possibly interdisciplinary team-based care a way to address maybe some of these health disparities that we are talking about as a arthritis community across Canada?
I think, again, bringing back the point that all of our research is about that one site so far. And from what we've heard from that particular clinic, um, that having everything in the one place is certainly something that's helping, I think, people from a variety of different locations or backgrounds to access care. So, for example, if people need to travel for like travel from far places in Ontario to get rheumatology care, they're also able to at the same time get their rehab needs met or their medication questions answered.
Sure.
So that's certainly really helpful so that they don't have to travel again and, pay for accommodations and all that kind of stuff. I think the ability at this clinic for them to do things like virtual education sessions, which is part of their model, has also been really helpful in reaching people who may not be able to attend the clinic for these education sessions about the different conditions that they might have. Um, and I think maybe one of the other things is having this phone line that patients are able to call and access and then speak to a pharmacist about their medication needs kind of at any time. And then they know that their call will be answered or, returned is really important.
Yeah, I echo a lot of that. I think also having the longer visits, I think allows a lot of patients that might generally be overlooked to be able to speak to their concerns a little bit more specifically in a little more of a detailed fashion. So I think that can sometimes help with some of those issues.
Well, great responses. And again, congratulations on the research. We're really excited to see something focused on areas that have a real benefit and impact on patients. And I guess my final question will just be, what are the plans or next steps in terms of advancing this great research?
Yeah, so I mean, our team, like this work is part of a series of projects that's trying to um, improve and implement team-based care or what we might call integrated care for rheumatic and musculoskeletal disorders, specifically in Ontario, but I'm sure there's a lot of learnings that can be drawn across all the different provinces. And so I think some of that's kind of what is coming up next for us is trying to understand what some of the perspectives are outside of the current clinic that we've talked to. So gathering perspectives from other places. Other types of team-based models probably exist out there. And we'd certainly love to hear from all of those people involved there to see, what are some of those key components of team-based care and how might we be able to sustain those types of models in the province.
I think that's on a nice note for us to end the interview. And let me just say that I'm always excited to speak to new guests on our show. But I'm always particularly excited about being able to talk to the next generation of arthritis leaders in Canada. And we're in good hands when I meet people like you. I feel really good about where this is all going. So congratulations again on your research, and thank you for joining us.
Thank you for having us.
Thank you.
And thanks to all of you who are listening or watching this episode. We really appreciate your support. Thank you for joining us and hope that you can join us again for another episode of hashtag CR Arthritis. Thank you. Goodbye.